ni ya daktari, lakini sasa clinic kama hiyo amefungua kwake nyumbani. So nikaenda mpaka pale, nikamuelezea, akaniuliza ina miezi mingapi, nikamwambia. So akaniambia anahitaji, ilikuwa ya miezi miwili. Akaniambia anahitaji shilingi 2500.
At 28, Mary, not her real name, has already procured 3 abortions. One unintended pregnancy after another, this mother of one has turned to an eye specialist who operates a private eye clinic in the area.
Okay, wakati niliamua hii ya 3 kutoa, waliingisha mashini, wakasaga mtoto pale ndani. Kisha wakaingisha shrink ya kufuta dawa. Lakini hiyo ni kubwa. Wakafuta ule mtoto, wakamvuta, naye kuvuta nilikuwa nasikia uchungu sana.
A study on complications of unsafe abortions released in August 2012 reveals that every minute in Kenya, a woman aborts. Nearly 1 in 4 leads to complications that have to be treated in hospital. In October 2012, the Ministry of Health launched guidelines to reduce risky consequences of unsafe abortion, including death. Now, these guidelines were to direct medical practitioners on when and how to perform safe abortions. However, in December 2013, barely a year later, this document was suspended on grounds that there was need for wider stakeholder consultation. But without clear guidance, women are left to seek these services at the hands of unskilled practitioners.
Nilikuwa naumwa. Mimi mwenyewe hata sikuwa naweza kufanya chochote. Singeweza kuambia mtu yote kwa sababu hiyo nilikuwa nikijua ni makosa. Lakini nililala for about 1 week. Niko mgonjwa seriously. Nilibleed ya kutosha. Kama ingepimwa, ilikuwa kama ni mitungi kadhaa.
2 years ago I encountered a girl who had undergone a clandestine abortion. They had gone into the cervix, into the uterus, and perforated her uterus. So what does that mean? It means you have to go into theater and you have to remove that uterus because she was bleeding, and the only way to save her life was to remove her uterus. So you can imagine this girl of 14, 15 will not be able to be pregnant again.
According to Dr. Dulafil Abdulaziz of Lamu County Hospital, post-abortion care is also weighing in on the already constrained free maternal healthcare budget as hospitals treat most post-abortion care cases under maternal complications.
Most of these women will present with features of what is called the incomplete abortion, where the cervix has already been opened, okay? Or they have taken some drugs that are causing the baby to come out. I am not a judge. The doctor cannot ascertain whether it was clandestine or not clandestine. In my diagnosis, the only thing I can say it is an incomplete abortion. That is covered under the free maternity care.
The average cost of post-abortion care at the facility equals that of a normal delivery at 1,500 shillings per admission, an amount that is footed by the government under the free maternity services. Records from Lamu County Hospital indicate that last year alone, 1 out of every 7 patients who came in for post-abortion care had undergone an unsafe abortion. Lamu County government spent about 195,000 shillings treating these complications. Government data further indicates that at least 1 out of 6 unsafe abortions could have been avoided if the unmet family planning needs were met. In 2012, 7 out of 10 women who had an unsafe abortion were not using any contraceptives. Mary, then married, was not using any contraceptive when she got pregnant.
Kisema kwamba maneno na family planning sio lazima.
Studies show lack of knowledge, fear of side effects, lack of access and opposition from partners as some of the reasons women avoid contraceptives. Injectables are the most common used contraceptives according to the latest Kenya Demographics and Health Survey. This, usually administered free in public hospitals, cost the government about 150 shillings per dose. A dose lasts 3 months, so this would cost the government about 450 shillings per woman in a year. The amount of money Lamu County spent on unsafe post-abortion care could have provided injectable contraceptives to about 400 women. The situation in Lamu County is replicated across the country. A study carried out by the Ministry of Health in 2012 indicates that about 120,000 women were treated in public hospitals for complications from unsafe abortions. Providing these women with injectable contraceptives would cost about 54 million shillings. Instead, the government spent at least 3 times more by providing them with post-abortion care through the free maternity program. These statistics only indicate a greater need by the government to bridge the unmet contraceptive needs of women as a preventive measure against unintended pregnancies. According to Dr. Dulafil Abdulaziz, making abortion illegal does not stop it from occurring. It simply forces women to seek dangerous alternatives.
You will tell them, no, I can't do it. But then they will come again after 1 week for you to take care of the complications. And when the complications including death.
Mary chose abortion after her husband left her when she got pregnant.
Unajua mnaweza kaa na mtu mara ya mwisho anakukataa. Ama mnakaa na mtu mara ya mwisho anasema hiyo mimba si yake. So uamuzi wenye huwa tunaona afadhali kutoa.
For now, the reality of the matter is, unless a new approach is adopted, deaths from unsafe abortions will continue to be recorded, thereby stalling the country's developments in combating maternal mortality.
Nikipata mimba nyingine kama staki, nikiona sina means nyingine ya kumsaidia ama nini, nitatoa. Siwezi kuwadanganya kwamba siwezi, nitatoa.
The country too will continue to spend more in treating complications of women who choose to follow the expensive route of unsafe abortions. Lusanji Begethan, Channel 1, Weekend.